All right, we are live once again with Toronto's Associate Medical Officer of Health. Dr. Vinita Dubey joins us again this week to answer your COVID-19 questions. Doctor, thank you for joining us again this week.
Hi, good afternoon.
Good afternoon. So my name is Dilshad Burman, and I am a web writer with CityNews and 680 News, and I will be moderating this chat today. We have had a lot of questions come in over the past week, so let's get started right away.
Okay.
Alrighty, so let's start with this first one. I've seen this come up a lot on social media as well. Sam works in healthcare and is concerned about a recent study from Korea that suggests that kids aged 10 to 19 are also spreaders of COVID-19. And they say if schools open and children return to school, do you think that children will then become super spreaders of COVID-19, because we've seen how the common cold passes around kids so often, and there's a large evidence of common cold in school-age children. They say that they work in the healthcare field and are concerned about the implications of this when it comes to providing care for their patients. And if their child comes home with something like a simple cold, should they then isolate for 2 weeks out of an abundance of precaution?
Okay, so this is a really good question and really ties into school reopenings. We know we need to get schools open to get kids back to school. We can't keep them home forever. But we also know that going back to school is not going to look like it did in March. Mm-hmm. And there's definitely, I mean, the evidence for kids, I think, is inconclusive by my estimation. We know that kids, COVID may not be like influenza where they can be super spreaders, but maybe they can, and we just don't have the full evidence on that. We haven't had enough kids in school, I think, to really fully understand that. There's no question, though, that kids can still get sick. The older you are as a child, the more sick you could potentially get. We know adults get more sick than, say, younger children. And so what this means is that when we open schools up, we need to be able to open them up in a way that we can prevent the spread of COVID. And I think that that's the bottom line here. And so we've talked to our school boards in Toronto. They're developing their proposals, and it's talking about using public health measures to have schools open and places where children can learn and socialize, but while reducing the spread of the virus. So it means, for example, being in cohorts, perhaps smaller cohorts of students, so your risk of spreading it across the school will be different, frequent hand washing, frequent cleaning of surfaces. Another big thing is screening. And so making sure that if you actually developed a cold, you got back to school, you developed a cold, well, that morning you would probably not send your kid to school, but if they showed up at the door and they said, yes, I have a runny nose today, they actually would not be admitted to school and they would have to go home. So then the question is, well, your kid now has a cold, how long do they need to stay home? So what we would recommend is actually that they get tested. We need to test our children to really understand what COVID, how many kids are actually really being infected. If you actually look at places around the world, even if you look at places like Florida, where there have been many children who have been tested, the testing proportions are so much smaller in children than they are in adults. And so I think getting a child tested who is symptomatic, if it's negative, and the symptoms go away, then 24 hours after their symptoms get better, with a negative test, they could go back to school. But if they have a runny nose for other reasons, they know that they have chronic allergies, it's a known problem, for sure it's not COVID, well then that would be something that could be excluded and they wouldn't have to stay home for that. So these are some of the things that we're trying to work through to be prepared for school, to be able to provide guidance to school boards and also to parents.
Right. And I mean, there's a lot, like we've been talking about over and over and over, it's the new normal. We're going to go back to work, we're going to go back to school, but it's going to be so different in terms of how we go back, how we interact with other people, and how we stay safe, right?
Yeah, because we know that just opening school doors and letting kids in just so that they can get an education is not the right way to do it, because definitely you're going to get spread. In Toronto, we still continue to have a dozen or more cases reported every day. And so we know that we have community transmission. And without putting in public health measures in schools, we will see that the virus will spread in those environments. And so I just want to assure you that we are working on providing guidance to school boards. They've actually taken our guidance. They've come up with really great proposals to mitigate the spread in schools. Yeah.
That's really good to hear. That's actually really reassuring. Amazing. So let's move on to some travel questions. Lots of travel questions now that stage 3 is happening in other parts of Ontario. Not quite Toronto yet, but other parts of Ontario, sorry. Okay, so Sabrina says, my mom is 86 years old and is planning to return to Canada from Pakistan, where she had been delayed because of COVID-19. Now, in terms of quarantine, can she stay in my condo or will she have to stay somewhere else for 14 days?
If you have a safe space for her to self-isolate, ideally with a separate room, separate bathroom, then absolutely have her stay with you. When she needs to go into a common area like the kitchen, she can wear a mask, you can wear a mask. But we would recommend that you self-isolate in a private residence with a private room and bathroom if possible.
Okay. Another one about travel. If I fly from Vancouver to Toronto, is it safe to stay with my mom in her senior's condo? My bubble is under 10 people. This is from Lisa.
So I think if it's a senior's condo, you would want to first check in to see what their rules are, to see if they're allowed visitors, if they're allowed overnight guests. There are no restrictions with travel within Canada for Ontario, so you certainly wouldn't have to quarantine. I think, if you're being safe and you're going to see your mother who's elderly and you're confident that that risk is low, I mean, there's nothing stopping you from staying with her. I think what our message has always been is we want to put a stronger shield, a stronger protection around seniors. And if there's any chance that you could be incubating and could pass it on to your mother, then that's something to keep in mind. Another point, though, is that if you're staying with your mother, do you have a separate room that you could be in, a separate washroom? I mean, all of those, when you're, if you're concerned, you could wear a mask when you're visiting with her as well, when you're close. And that can also be measures that you could take as well.
Okay. Lots of people asking about the 14-day quarantine. Shirley, as well as Sarah, how long do you expect the travel quarantine will last? We want to travel out of Canada in mid-October, but will not go if we have to quarantine upon return.
You can see right now the travel quarantine and the closing the borders is being extended just small increments at a time. And so it's really hard to predict what October is going to look like. I think right now, if you're making plans, you should plan that you would be quarantining for 2 weeks and hope that things will change. But right now, that is the measure that's being recommended.
Mm-hmm. And then if one has to quarantine after travel, what is the protocol in terms of interaction with other members of the family?
So again, you have to self-isolate in your private residence. You're not to go out. If you want fresh air, you could go on a private balcony or in a backyard. If you're living with others in the home and they have not traveled with you, then ideally have a separate room, separate bathroom as much as possible. In case you could be incubating, you don't want to be able to expose them.
Right, right. This is an interesting one, considering that restaurants are open, at least patios are open. Is it safe to use restaurant utensils, plates, and glasses, since COVID can stay on surfaces?
Right. So, I mean, we have protocols in place for restaurants to use so that they know how to, so that, first of all, that the cutlery and the dishware is cleaned according to the recommendations, the guidelines. That's actually in regulation. We're recommending for utensils that they be wrapped up in napkins, so that way can't inadvertently be touched by someone. So that's certainly something that I would recommend in a restaurant. And then the glasses themselves, again, through drinking or eating, we haven't had any evidence that COVID can spread in that way.
Right, right. Okay. Let's see, we've got a lot of stage 3 questions as well. Jessica and Jack are both asking, is it too early for stage 3, considering that we're still seeing increasing numbers of cases in Ontario? and people aren't necessarily following all the protocols, should we be waiting longer?
Right. So part of the province has gone into stage 3, and there have been some increases in parts of the province that have moved on. From what we know is that some of those increases are related to social gatherings. Some of them are actually in private residences. So they're not even related to going to a restaurant per se. So I think the main message is whether we're in stage 2 or whether we're in stage 3, wherever we go, like when we go to someone's house, if we go to a restaurant, if we go to a grocery store, we have to maintain that distance. We have to do our precautions, wash our hands, wear a mask, all of those things, because we're seeing that the virus is spreading in those encounters. In social settings, you tend to forget to keep that 6 feet distance. And so I think that that's an important point. I think moving into stage 3, I think Toronto has not entered there. And so we're looking at the numbers. We're waiting for the province to give us the green light. But even when Toronto does move to stage 3, you can expect that the case numbers will increase a bit. And we're prepared for that. What we don't want is to have large outbreaks and broader community spread. And I think those are the things that we're keeping an eye on to see if we need to dial back, for example.
Right. And there is a possibility that we will dial back if things get out of hand.
We've seen in other provinces that they've pulled back on some of their openings, maybe not completely back from stage 3 to stage 2, but they have added additional restrictions based on some of the cases that have emerged there.
Right. And then Seth asks, with stage 3 on its way, are people in high-risk groups able to go back to work?
Well, I guess the question is, what's the definition of a high-risk work? Some things are not going to open in stage 3, like amusement parks are not opening, large venues are not opening. Even when things like, banquet hall or indoor dining, those things open, there will be many restrictions attached to them. So no matter what is opened in stage 3, whether it's considered high risk or low risk, everyone is going to have to take additional precautions. A higher risk setting might be a setting where you have more close contact with people, and in that case, it will look different. You will have to maintain a distance, or you'll have to wear precautions. That's what it's going to look like.
Okay. Okay, this is a more generic question. We've heard a lot about the symptoms of COVID-19. What are some of the more mild symptoms that you would connect with COVID-19?
Some people just get a scratchy throat. Some people might just feel a bit of a sore throat, a bit of a runny nose, just not feeling well, a headache with a mild fever. The symptoms can sometimes be quite mild. One symptom that people might not actually identify is losing the sense of taste or smell. And if all of a sudden you're finding, hey, my food's not tasting as well, or, why can I not smell those roses, for example, that actually may be a sign of COVID and might be an indication that you should get tested.
Okay, and we have another question coming in just now about schools. What do you consider appropriate PPE for schools? Is the board doing any planning, as it's only 5 weeks before the start of school?
So absolutely, the boards are all doing planning. They're coming up with their proposals. They have to come up with 3 proposals, one for full day learning, one for adaptive day learning, adaptive model, and one for online only. They are sending their models and proposals to the Ministry of Education, who, with advice from the Chief Medical Officer of Health, the public health side, will come up with their decisions. Toronto Public Health, we are providing guidance to school boards as they come up with those proposals. And we're also working with our public health colleagues provincially to talk about some of these matters. And so we would expect that guidance on, for example, should children and staff wear masks in schools, that some of that guidance we're waiting for, some of it to come out from the Ministry of Education. And so while schools are around the corner, we still do have a bit of time to figure out and to hear what is the recommendation going to be provincially on for schools.
Would we possibly see all students wearing masks in school, or gloves, or less or more of that?
Definitely not gloves. There's no recommendation for wearing gloves, that's for sure. For day-to-day wearing gloves, prevents you actually from washing your hands, and it doesn't necessarily stop the spread of COVID. The real question is going to be around masks, and it might be also in certain situations where you have maybe a teacher who works very closely with a student who may have a particular needs or education where they can't keep that distance. You might see additional PPE requirements in those settings as well. And so really what we're looking to see is what's the guidance going to be for children in particular, students. Will it be age-based? Will it be based on what level of school you're in?
Right.
And we're waiting for some of that. It will also depend on what's the model. How does the model allow for physical distancing at all times? Because if in the school you can manage that for most of the day, well then the use of masks might not be as necessary compared to if you're in a classroom with many students and cannot keep that physical distance. So there's still a lot that we're working with the school boards on. We're thinking it through. We're helping them with guidance. And so I feel like I say this a lot on this, more to come. I mean, you know, but it's not like nothing is being done, that's for sure.
Right. And it's a day-by-day process, right? Like we're learning new things about the virus every day. We're learning new things about better protocols every day. So even though 5 weeks seems really like it's coming up really soon, it's still 5 whole weeks that you have to put protocols in place.
That's right. And I think one thing that's worth noting for the parents who are on the line is the expectation is that the Ministry of Education will give guidance to the school boards on which proposal they can use. And then that the school boards, at least in Toronto, are planning then to survey the parents to say, okay, this is the proposal that we will be using in September. What is your plan? Do you plan to send your child to school, or do you plan to do exclusive online learning? And I think once you know what the proposal is, what school is going to look like, that will help parents to make their decision as well.
Right. So parents will definitely be consulted, and there will probably be a choice between sending your child or not, and then staying home and doing online learning.
That's right. Yeah.
Okay, perfect. Okay. Moving on to vaccines. Jalen asks, how much animal testing has been done on COVID-19 vaccines, and what is in the vaccine?
So there are actually many vaccines that are being developed currently, and not all of the vaccines that are in their initial stages actually end up being licensed or being ones that you can actually use in here. Usually the initial stages require laboratory testing, and so there are many stages that are taken, many different types of experiments that have to be done before you can actually get to the stage where you can actually inject the vaccine in people to see if it works or not. So and so the different types of vaccine that are being developed have different components in it. Some might have a piece of the protein, some might have a piece of the gene, but it depends on the type of vaccine that's being developed. And the real question is going to be, whatever vaccine it is, does it work? Who does it work for? How effective is it? Do you need 1 dose or 2 doses? So those are, and so that's why we'll have to see when we have what we call a candidate vaccine, when it's licensed, we'll be able to tell you a bit more about what's in it, who was it tested on, did they do animal studies, for example.
Right. Okay, more about moving around outside. Victor asks, do I need to wash my clothes each time I come in from outside? And how often should I disinfect my house and my furniture?
So I think the most important thing that we need to remember is that the virus is spread through close contact. And so the surfaces we think are still a lesser way that the virus spreads. And I know that there are a lot of people that are really diligent about cleaning surfaces, cleaning their clothes, that they're doing that to help prevent the spread. But I think it's really important to know that where you've been and who you've been in touch with is actually more important for the spread of this virus. And so if you were with someone who had COVID and you can wash your clothes in regular laundry, that would be fine. Do you need to do a deep cleaning of your house every day? Probably not. What we're recommending is that in public spaces where you have surfaces like a doorknob, a light switch, that those be cleaned regularly. and that in public places, like a public bathroom, that it be cleaned at least twice a day or more if required. But for your personal home, if it's only you who's living there, I don't think you have to worry as much about doing that deep cleaning every day, for sure.
Okay. I guess this is the same, almost the same question. Appin asks, should you shower after returning home from grocery shopping or other public spaces? Do you have to shower head to toe?
So again, is the virus on your skin? Do you have to worry about it? I think the more important thing is when you've been out grocery shopping, making sure that you keep that distance. There's nothing wrong with showering by any means, but we're certainly not making that recommendation that every time you go out and come in that you must shower.
Okay. So a couple of mask questions, I guess. Firstly, where are all the places that masks are mandatory? Monique asks.
So in Toronto, the mask bylaw requires that you wear a mask in all indoor public spaces, and that's included in the bylaw. Workplaces may also have their own guidance on wearing masks, and other places like apartments and condos, while they're not included in the mask bylaw, we have certainly told those places through our guidance that we have a strong recommendation that they can have policies to have masks required in common areas like the elevator, the front entrance, laundry rooms, for example. Right.
And then John asks, can I leave the house for fresh air without a mask?
Yes, you can. Masks are recommended outdoors only when it's difficult to maintain a physical distance. If you're going for a walk, you're not taking an elevator to go down, you can maintain that distance while you're on your walk. There's no need to wear a mask. The risks for getting COVID in that situation are very low.
Okay, perfect. So this is, there's been a lot of talk about where the virus came from, and there's been lots of theories out there. And so I thought I would bring this to you. Hasini asks, how do we know that the virus isn't man-made?
Well, I guess what I can say to you is I don't know that. I don't know where the virus came from. I don't know the origins of the virus. I can tell you that I'm a public health doctor, and my role is to actually prevent the spread of the virus. And so no matter where it came from, no matter who its mom and dad were, so to speak, whatever its origins were, it's here now, and I know that it spreads through close contact from respiratory droplets. And so regardless of the origin, it's here, and we have to do what we can to prevent the spread.
Right. This is a simple enough question. What is the stage 3 limit for indoor wedding receptions?
So when we move to stage 3, it will be a maximum of 50 people indoors and 100 people outdoors. If you are having, and so that would include a wedding reception. If you are having a wedding, for example, in a place of worship, they could have 30% capacity for that room particularly. Okay.
So there is that. So if the place of worship has capacity of 200, then it would be 30% of that. It doesn't necessarily have to be just 50 people indoors.
That's right. Yeah.
Okay. There's a loophole there. So this is interesting. Rob asks, instead of everyone staying home healthy and shutting down the world for 4 months, what is wrong with everyone under 60 just getting the virus once and for all, like we do with chickenpox with kids? You just lump them all together, everybody gets it at one go, and then it's all over. He says, I'm home anyway, and I would rather be sick for a few days and then go back to work rather than staying off for all this time.
Yeah, I think it's a good question. I mean, if we could guarantee that you were only sick for a few days and then could go back to your regular activities, then I think that's something that we would have recommended. But we actually can't guarantee that. We know that some people who are otherwise healthy can actually die from this virus. So you can't guarantee, okay, I'm just going to get the infection, recover in a few days, and now I'm clear. The other thing that we can't guarantee is, so you get it, you have a mild infection, doesn't mean a year from now that you'll be immune. So it could have been all for nothing, we don't know that right now. And finally, we don't actually know if there are long-term consequences from this virus. We know with viruses like measles, you can get it, you can recover, and then years later get a very serious complication. And so it's all of those kinds of reasons that we're not recommending it. On the healthcare side too, we know that if many people get infected, we don't have enough ICU beds to help them recover in the hospital. And so that, again, is another really important ethical question to think about.
Right, absolutely. And so actually there's a follow-up question from Douglas then, and I think you might have answered it already, but we'll ask it anyway. Can younger people with COVID, even after they survive COVID and they've gotten over it, could there still be damage to the body? Could there be long-term consequences there?
I know people are talking about this, and all I can tell you is we only have, 7 months of experience really of this virus. So we don't know, even a year out, 2 years out, 3 years out, could you have longer term effects from it? It certainly does happen with some viral infections. And so I can't definitively say no or yes on it. It's certainly unknown.
Right. Okay. This is an interesting one. Teresa asks, is there something about people taking ACE inhibitors that makes them more predisposed to blood clots if they are COVID-19 positive, or is it the other way around?
So I'm not, I can't answer that question definitively right now. I know that there are a lot of studies that are looking at the interaction between drugs and COVID. What we do know, though, is if you're on an ACE inhibitor, you're probably on it because you have high blood pressure. And we know that high blood pressure is actually one of the health conditions that if you have it can actually make COVID worse.
Right.
So whether it's related to the drug or the disease, all of these kinds of things, which way is the direction? Is it, it's not clear right now. And that ACE inhibitors and the effect on COVID is certainly not my area of expertise.
Right, absolutely. Okay, this is a simple enough one. Tom asks that he would like to know when vaccinations will resume at pharmacies.
So we are currently working on flu vaccinations for the fall. Mm-hmm. And, we can expect that flu vaccines will be available at pharmacies this fall with precautions. And so we are certainly starting that process of getting pharmacies prepared to provide flu vaccines.
Okay. Michael asks, how are we able to see lower numbers of cases than day one of closing down? What changed? People are going out now more than they were before.
So the question is, why are we seeing more?
How are we seeing lower case numbers now than in the beginning?
Okay, yeah, so that's a good question. So we've actually done a very good job of flattening the curve. So the overall rates of COVID in the community are lower, and people are taking precautions. And so we've gotten in Toronto, we're doing better than we've ever done in terms of our daily case count. That being said, as we open things up, as people relax their restrictions, you could see a rise in cases, but it might take a couple of weeks before we see that. And so there is that lag. And that's why as we get into stage 3, keeping a close eye on where we're at and what we're starting to see is going to be really important.
Right. So this is actually then a related question that's coming in right now. How come we haven't seen a surge of COVID cases after all of the protests that we had, a few weeks ago?
It's a good question. And I think this goes back to why we say outdoors is actually safer than indoors, because we've seen a number of outdoor events. Some where people were physically distanced, some where people were wearing masks, but not consistently. And, are there cases that we missed that people weren't being tested? We know in Toronto that our testing rates are quite high. Thousands of people are getting tested. And so I think what it boils down to is that outdoors, because of the ventilation, because of there's even more space, the surfaces are not contaminated, that they are definitely lower risk. And so that's kind of anecdotal evidence there.
Right. there, Dave asks, when is Ontario's COVID alert tracing app coming online? Do we have that for Toronto as well?
Will be available for the whole province, including for Toronto, and we're waiting for it just as you are. I think it's better to delay it to make sure that we have any kinks sorted out. The app itself can be quite helpful because the more people that use the app, the more it will help with contact tracing. And so, you know, hopefully it will be out shortly.
Okay. Here's another one about masks that I feel like we've talked so much about masks, but maybe we haven't talked about this particular one. Rebecca asks, what is actually the best mask to wear? She says that N95 is only good for incoming air and it doesn't filter out the output. So which is the best mask to wear for just a regular member of the public?
Okay, for a regular member of the public, you do not need to wear an N95 mask. In fact, the N95 masks need to be fit tested. So I work in a hospital, I've been fit tested, I have one that fits my face perfectly, and that provides that protection. N95 masks that fit perfectly can actually be difficult to wear because they are so sealed and so protected. So they're actually can be difficult to wear routinely when you're going to a grocery store, for example.
Right.
The best mask is the one that's most comfortable for you. And so so if you're wearing a cloth mask, cotton materials, breathable materials that are thickly woven, 2 layers are the best type of mask. We do not recommend that you have a mask with an exhalation valve. That's another question that's come up. What it does is your air goes out, but it's not filtered, and it's not filtered for the COVID virus. And so you could actually contribute to spread. You think that you're protecting, but actually because your air goes out, you're actually contributing to spread. Wow. So a cloth is still breathable and still allows you to breathe. And so you have to find one that fits you in a way that, and you have to figure out how to fit it properly so that you can actually breathe properly with it on.
Okay. That's very interesting about the N95 because you would think that would be the highest level of protection and everybody would be wearing them. But if it's that difficult to wear for long periods of time, it's probably not the best for you, right?
It is the highest level of protection for sure, but it's not necessary for routine day-to-day things. We save the N95 masks in the hospital setting where you're doing things where the virus could be generated in the air, for example. So its use is defined to specific circumstances right now. Okay.
And I think we are actually out of time. I didn't even realize it's already 1 o'clock. That half hour went by really fast. Thank you again, Doctor, for taking the time and so much effort into answering all of these questions every week.
Yeah, my pleasure. We'll see you next week.
Okay, see you next week. Bye.
Bye-bye.